This portion of CardioSource video news coverage of AHA 2010 is brought to you by Novartis Pharmaceuticals Incorporated.
Well, I'm here with Dr. Adrian Hernandez of Duke, who will tell us about the key results of a long-awaited trial, the Ascend heart failure trial, looking at Nesiritide. Now, Adrian, let me ask you, this is an agent that we use for heart failure, but that's had a bit of a checkered past. Can you bring us up to speed as to how we got to this trial?
Yeah, so it's a very interesting story. In 2001, it was approved by the FDA, and it really had a great market uptake. But then in 2005, two meta-analyses came and questioned whether there was a mortality risk and a risk for renal dysfunction. And so really it changed the story in terms of Nesiritide's use. We were fortunate to have Dr. Braunwald chair a panel and say a clinical trial needs to be done to examine the effectiveness of Nesiritide and the safety, and that was Ascend.
Okay. So as a vasodilator approach to diuresing a patient coming in at heart failure, this is really a different mechanism that you apply to lots of patients.
Yeah, so this is actually the largest acute heart failure trial ever done, so over 7,000 patients. And while there has been a lot of interest in terms of using vasodilators in acute heart failure, it's not very common a practice. And so really Nesiritide was that test in terms of examining what the role of Nesiritide is in patients that come in with acute heart failure. Does it help their breathing? And also, more importantly, does it help outcomes?
Right. Well, so I think the key question was mortality, but then also how did it work? So what did you find?
Yeah, so I think in terms of the impetus of the trial, in terms of safety, that it was clearly Nesiritide safe, that there was no harm regarding mortality, no harm regarding renal function. In fact, the placebo group for the death readmission endpoint was 10.1%, and for Nesiritide was 9.4%. So lower, but not statistically significant. Regarding the relief of breathlessness or dyspnea, there is modest improvement between the control group and Nesiritide, and because we had two primary endpoints, we split the alpha, and the dyspnea endpoint didn't meet our pre-specified criteria. So I think what we found is consistent with the prior results, but in terms of background therapy, or say the placebo effect, that background therapy does eventually catch patients up in terms of how they're breathing and how they're feeling.
So what would you say for me who would face some of these patients? Which type patients would you think about? Looks like it would apply to some but not all patients.
Yeah, and I think that's an important aspect of the trial, is that this was an all-comers trial. So really the principle was that to keep it simple, if patients had a sign or a symptom of heart failure, they could be enrolled in the trial. And so with 7,000 patients, it's nearly 12 times the largest trial of Nesiritide. And so within that, we see some interesting patient profiles that do have an effect with Nesiritide, with all the caveats of looking back. But really, it's the patients who are sicker, who come in earlier in their hospital, patients who have a low ejection fraction, the patients who have more symptomatic, and who haven't really been on any vasodilator such as nitroglycerin.
Right. Okay. Well, I think this is a very exciting result, long awaited, very reassuring, I think, on the safety profile, and then we'll look forward to further analyses to help us sort out who should and who shouldn't get Nesiritide. Well, I'm Chris Cannon for CardioSource Video News.
Special thanks to Novartis Pharmaceuticals Incorporated for supporting continuing coverage of CardioSource Video News at AHA 2010.